Namaste. Welcome back to SLG HELLO DOCTOR, your fortnightly capsule of health information. September is Gynecological Cancer Awareness Month, especially uterine cancer. It is estimated that approximately 3.1% of women will be diagnosed with uterine cancer at some point during their lifetime. The new cases recorded stand at 28 per a lakh of women annually, and the incidence of death is about 5. As is the case with most cancers, the earlier it is detected and treated, the better are the chances of survival and a good quality of life. To get more insights on uterine cancer, we are talking today to Dr. Archana Prathipati, Consultant Radiation Oncologist at SLG Hospitals, Hyderabad. Welcome, Doctor.
Thank you.
Welcome to SLG Hello Doctor.
Thank you.
Dr. Archana, there's so much we want to understand from you today. But first of all, what is uterine cancer?
Uterine cancer is a part of gynecological cancer. So among gynecological cancers, we talk about uterine body cancers, that is womb cancers, and cervical cancers, that is uterine cervix cancers, ovarian cancers, fallopian tube cancers, and vaginal cancers. Apart from that, external genitalial malignancies like vulval cancer also will be considered under gynecological malignancies. But the main, like in a developing country like India, the majority of the cancers we speak about is uterine cervical cancer. But as the westernization of our lifestyle is getting into pace, it is time we speak about uterine body cancers also, uterine tumors, that is, we call them as uterine tumors. So uterine cancers, why we are speaking about them is the incidence is rising. And we also need to talk about awareness regarding uterine cancers, because when we speak about cancers, 30% of the cancers are preventable and 30% of the cancer deaths are preventable when we diagnose them early. So when we know about the causes of cancers, we can prevent them if we know the causes of cancers. And when we know how to diagnose them early, 30% of the cancer deaths are preventable. Awareness is nothing but getting us to know what are the causes of cancer and what are the steps to diagnose it early so that we can cure ourselves from cancer. So today we are going to speak about uterine cancer because the incidence of uterine cancer is rising, and September is Gynecological Cancer Awareness Month, especially Uterine Cancer Awareness Month. So we are speaking about it because we should get ourselves aware about the uterine cancers.
Dr. Archana, what are the causes of uterine cancer? How does one contract it?
Uterus is a hormone sensitive organ, so the causes are also hormonally related. So for example, obesity. With obesity, we will be getting excess level of estrogen. So obese females are more prone for getting uterine cancer. Similarly, excessive hormone exposure like early menarche and late menopause. The time we spend with hormones is higher when we have early menarche and late menopause. So this also adds up as a risk factor. And apart from that, diabetes, metabolic syndrome, because diabetes and metabolic syndrome do increase the chances of obesity. So the level of estrogen hormones are higher in this population. So the risk of getting uterine cancer is little higher. Apart from that, hormone replacement therapy. When we use hormone replacement therapy for counteracting menopausal symptoms, sometimes the menopause is very troubling. In that scenarios, we usually prescribe hormone replacement therapy. So when we are giving hormone replacement therapy, giving estrogen alone is a risk factor for uterine cancers. Apart from that, hormonal therapies like tamoxifen. This tamoxifen therapy we usually use in breast cancer patients. So tamoxifen therapy is also a risk factor for endometrial malignancies. And BMI, high BMI, that is obesity. This is also a risk factor for endometrial tumors. And nulliparity, that is when we don't have any children, the time which we spend with hormones is higher. So that is also a risk factor for uterine tumors. So these are the known risk factors, and many of the risk factors are preventable. When we are using hormone replacement therapy, we try to, we can prevent it, we can decrease it. So there are preventable risk factors for cancer, where the non-preventable risk factor, that is non-modifiable risk factor, is Lynch syndrome. Some people, like for example, families or pedigrees of Lynch syndrome, they'll be at higher risk of colorectal malignancies, uterine malignancies, and sometimes breast malignancies also. So these syndromic malignancies are non-preventable things, but we can screen them for early detection. So these are the limited risk factors for known causes of uterine cancer.
What are the symptoms one needs to watch out for, ma'am?
Uterine cancers, the main symptoms which we see, abnormal vaginal bleeding. For example, when a postmenopausal lady is presenting with vaginal bleeding, there is the probability of her being having uterine malignancy is very high. So abnormal vaginal bleeding is a risk factor, and abnormal vaginal discharge is a risk factor. Apart from that, altered urination symptoms or altered urination patterns are also like pelvic pain, that is pain in the lower abdomen, when we are feeling a mass in the lower abdomen, or when the patient is having fullness, like without any diet or proper diet also, if the person is complaining of early satiety or fullness in the stomach, that also might be symptom of uterine cancer. Also unexplained weight loss. So when we are not doing anything and we are losing weight, it might be a symptom of unexplained malignancy. So these are the symptoms of uterine cancer.
Doctor, how is uterine cancer diagnosed? Are there any side effects from all the tests that we do?
We can diagnose uterine cancer sometimes by simple pelvic examination. So when we meet a gynecologist or when we meet an oncologist, a simple clinical pelvic examination can diagnose it. Or a simple trans-abdominal ultrasound scan, that is scan which we do much often also, can be used to diagnose it. And trans-vaginal ultrasound scan, wherein a probe is inserted into vagina, also helps in diagnosis. Or MRI of the pelvis, MRI scan, that is magnetic resonance imaging of the pelvis, also can be used to diagnose it. And for a serous type of carcinomas, we can also use tumor markers like CA-125 to measure it for diagnosis. So these are the simple tests. When we have a high clinical suspicion on the above tests that there is probability of endometrial malignancy or uterine malignancy, then we can proceed with endometrial biopsy. In endometrial biopsy, a very small probe or a very small tube is inserted into uterine cavity through the cervical canal, and suction is applied. So a small bit of endometrium is suctioned outside, and we will be analyzing it in the lab by an experienced pathologist. Or sometimes when the bit is not adequate, we might need much larger bits to study. In that situation, we can also do dilatation and curettage. That is what we know as DNC. A DNC procedure also can be used for diagnosis of uterine cancer. Apart from DNC procedure, hysteroscope guided DNC procedure also can be used. These are the steps to diagnose the uterine cancer. So coming to the hazardous tests, so there will be any test will be having minimal discomfort. For example, trans-abdominal scan will be applying little pressure on the abdominal wall, so we'll be feeling little pressure. Similarly, trans-vaginal scan, there will be limited pressure in the pelvis. But hazardous tests are not being used for diagnosis. Even MRI test which we do, it doesn't use radiation, so it is also safe. So there are no hazardous tests for any diagnosis. All the above tests are safe with very minimal discomfort and pain. Majority of the tests are painless. Only biopsy procedures, dilatation and curettage does have a little pain, but we usually use some sort of pain medication to avoid or prevent it or minimize it. All the diagnostic tests are safe and easy to do.
Doctor, who or at which age group are we most likely to be affected by uterine cancer?
Uterine cancers, the commonest age of presentation is above 60 years. So the most age we see is above 60 years. But recently, because of westernization, we are seeing an increased number of cases among women who are 50 to 60 years. But the common age of presentation is 60 years. So any women, any postmenopausal lady presenting with abnormal vaginal bleeding, she should be evaluated for uterine cancers.
So doctor, what are the treatments available for uterine cancer, and can it be treated non-surgically?
The treatment for uterine cancer is traditionally surgery along followed by radiotherapy and chemotherapy. Multimodality treatment is a treatment of choice for uterine cancers, which means surgery, radiation and chemotherapy. But for some people, like very early stage malignancies who desire fertility, we can try non-surgical treatment also. But it is not recommended except in few limited population and clinical trials. So surgery is needed at some point of time for uterine cancers, and usually it will be the first step of treatment. After surgery, the adjuvant therapies like radiation and chemotherapy might be necessary based on the stage of the disease.
Doctor, what are the various types of surgery that are available, and do we have them all in Hyderabad?
Coming to the types of surgery, like it can be simple hysterectomy or radical hysterectomy, or sometimes a pelvic exenteration also, depending on the stage of disease. But coming to the type, how the surgeon operates, it can be open surgery. That is, they'll be opening the abdomen and they'll be removing all the diseased parts. or it can be minimally invasive, for example laparoscopic surgery, or if the disease is very early, there is upcoming studies on robotic surgery also. So all the modalities which I have explained, like open surgery, that is laparotomy, or laparoscopic surgery, that is minimally invasive surgery, and a few centers are offering even robotic surgery. So all the above surgeries are available in Hyderabad, and we have minimally invasive surgeries available at our hospital.
It's break time on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్.
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. So ma'am, what's radiotherapy in the context of uterine cancer and what are the types of radiotherapy?
Radiotherapy is when we use high dose like high energy X-rays, that is mega voltage range X-rays are being used for treating tumors. In uterine cancer, we usually use it in adjuvant setting, that is after completion of surgery, based on the stage of the disease and the risk factors which we find on histopathology report. We usually send the patient for adjuvant radiotherapy. So radiotherapy, we usually treat uterine cancers with 2 types of radiation, that is external beam radiation, also known as LINAC radiation, or linear accelerated treated radiation, or brachytherapy. For example, when the patient is very low risk, we can simply treat the patient with vaginal brachytherapy to avoid a local recurrence. If the tumor is little like advanced stage, for example 2nd stage or 3rd stage, the patient might be necessarily treated with adjuvant pelvic radiotherapy. When the patient had advanced disease, for example if the patient has multiple nodes in pelvic and parietic region, the patient might have to be treated with external field radiotherapy with linear accelerator. We can treat abdomen, or we briefly can treat whole abdomen, or we briefly can treat vaginal area also. So these are the types of radiation which we use for uterine cancer.
Dr. Archana, does every patient need chemotherapy?
Uterine cancer is a chemosensitive disease. As many of the gynecological cancers are chemosensitive, as part of that uterine cancer is a chemosensitive disease. So chemotherapy will be using for advanced cases, like for example when the tumor is involving other organs apart from uterus, like for example ovaries or fallopian tubes, or lymph nodes in the abdomen, or lymph nodes in the pelvis. Patient might be requiring chemotherapy. Chemotherapy is usually in injectable form, and when the patient is having metastatic disease, that is when the disease is beyond the abdomen into lungs or bone or liver, then also we'll be treating with chemotherapy. So chemotherapy is usually used for advanced presentations. Early presentations, chemotherapy is not necessary in most of the cases. It is an optional form of treatment for some cases.
What are the major side effects of treatment that a patient needs to be prepared for, or their families also, because they are the caregivers?
We should speak about side effects of the treatment because cancer treatment, it requires a lot of effort and caregiver support. So coming to surgery, most common complications of surgery are usually bleeding and infection. But with minimally invasive options, the risk of bleeding is coming down. And with laminar airflow operation theatres, the risk of infection is significantly coming down. So every hospital is monitoring in-hospital infection rates, and they are using specific set of antibiotics. So the infection rates are coming significantly down. Well, coming to radiotherapy, the main toxicities of radiotherapy are acute gastroenteritis. because bowel is very sensitive, and while we are irradiating the tumor bed, we might be delivering some dose to small bowel or intestines. So the patient might be having acute gastroenteritis, sometimes radiation induced nausea and vomiting. But with the latest technical advancements in radiotherapy, that is intensity modulated radiotherapy, we call that as IMRT, or volumetric modulated arc therapy, we call that as VMAT. With the latest advancements, the side effects with radiation are coming significantly down. We are not seeing any grade 3 or grade 4 toxicities these days, because we are able to spare all the normal organs with the latest available techniques of radiation. And while coming to chemotherapy, the main chemo side effect we are worried about is myelosuppression. That leads to decreased white blood cell counts and platelet counts, which might be leading the patient into infection. But the availability of granulomonocytic colony stimulating factors, that is filgastrin or pegfilgrastim support, the incidence of severe neutropenia is coming down significantly. Also, the elements, the molecules are being refined and the chemo drugs are being refined. So the delivery is more focused onto the tumor tissues. So the side effects are coming down with chemotherapy also. We have additional supportive drugs which are available, which are like decreasing the incidence of chemotherapy-induced nausea, chemotherapy-induced vomiting and all. So the side effects are coming down. We are worried about the side effects of cancer treatment, but the latest advancements made cancer treatment safer and easier to and tolerable. So please don't be worried about the side effects.
Dr. Archana, what is the rate of survival in uterine cancer, and what is the risk of second malignancies?
So first I'll be speaking about the survival in uterine cancer. For example, when we diagnose the patient in stage 1, after multimodality treatment, the survival of stage 1 is up to 95%. So among, like for example, we treat 100 cases, 95 cases will be cured of the disease and they will be living for 5 years. So we always speak cancer survivals in terms of 5-year survival rate. So for stage 1, it is up to 95%. When we diagnose in stage 2, that is when the tumor is beyond the uterus into the adjacent organs, like for example, cervix of uterus, then the survival is up to 75 to 80%. When we diagnose in stage 3, that is when the tumor is beyond uterus into pelvic lymph nodes or into ovaries or into fallopian tube, the survival is up to 50%. But when we diagnose it in stage 4, that is when the patient had abdominal lymph nodes or it is spread beyond the pelvis, then the survivals drop down to 20 to 30%. When the patient had metastatic disease, the survivals are much lower, it is less than 10%. So the key to survival is diagnosing the patient in early stage. So early presentation, it saves the lives. So because it improves the cure rate. And coming to the second part of the question, that is what are the second cancers which we should be worried about? Because as I said, endometrial cancers, they have a genetic association in few people. The patient once cured of endometrial cancer is at little high risk of breast malignancies and colorectal malignancies. So after getting cured from endometrial cancer, as part of regular screening, we'll try to screen breast as well as colorectal malignancies also for the cured population. So second malignancies are seen in any cancer patient, but for endometrium or for uterine cancers, it is breast and colorectal.
Doctor, what came through was, as we mentioned earlier also, that early detection means the survival rate is close to 95%. So are there any screening tests that we can do beforehand, before even the symptoms present themselves?
Actually, endometrial cancer or uterine cancers can be screened with simple ultrasound abdomen. So transabdominal ultrasound or transvaginal ultrasound can diagnose majority of the uterine cancer tumors. So it can be used as a screening test. But the incidence of uterine cancer in India is only 1 in 190. So it is not being regularly offered to all people. Only high risk population will be offered screening as part of healthcare packages, or we can volunteer ourselves for a transabdominal ultrasound or transvaginal ultrasound scan. Also, the main point is to create awareness while the patient is for a menopausal lady. For example, when the lady is getting into menopause, we should explain her that abnormal vaginal bleeding is a sign of uterine cancer. So any abnormal vaginal bleeding or any postmenopausal bleeding should be screened, should be assessed properly. So we can also counsel postmenopausal people to get themselves screened for uterine malignancies. Firstly, there is no protocol to get as part of cancer screening.
Lastly, doctor, can you tell us about any preventive measures that we can take right from the beginning? Maybe diet, maybe hygiene, maybe just fitness and exercise?
Like uterus is a, as I said, hormone sensitive organ. So when we are using hormone replacement therapy, instead of using single agent estrogen, we can couple it with progesterone. So that is the best preventable thing. Also, when the patient is having long standing PCOD, because PCOD is also a risk factor for uterine cancer, so getting medical help early and getting treated is also going to be protective. And pregnancy is protective. It protects us from uterine cancer. So rather than staying nulliparous, having a child is also a protective factor. And also when the patient is having diabetes or like metabolic syndrome or obesity, getting into right BMI, that is getting into right weight for height, is also a protective factor. These are as part of lifestyle, a healthy lifestyle, we can adopt a few of them. And also regular physical activity is also thought to streamline the hormones and protect us from uterine cancer. Apart from that, coming to diet, diet rich in green leafy vegetables and plenty of fruits, whole fruit rather than fruit juices, and avoiding like for example red meat and processed meat like sausages is also going to help us. Consuming fiber rich diet like legumes and beans, peas is also protective factor. Similarly, avoiding like high calorie diets, getting into natural fiber rich diet is also going to help. So these are the preventable measures, lifestyle helping, positive lifestyle measures which prevent us from the, which help us to protect ourselves from uterine cancers. So as part of the awareness, we usually explain them, all the awareness steps.
Thank you, Dr. Archana, for walking us through the many facets of uterine cancer so patiently. Like they say, forewarned is forearmed.
So I should also thank you and the organizers for providing me the opportunity to create awareness on uterine cancers. So please be aware on uterine cancer. And if you have any questions, we are always available to answer.
And like
Thank
Dr.
you.
said, screening is very important. Let's all go ahead and get that first. Viewers, don't forget to hit the bell icon to keep track of all that's happening at SLG Hello Doctor. We'll be back in 2 weeks from now with another expert and another interesting topic. Until then, look after yourself and your dear ones. Stay safe, stay healthy. Namaste.